Thank you so much for joining today's Aligned Modern Health Digital Doc conversation on PCOS, or Polycystic Ovary Syndrome. We are joined today by functional medicine physician Dr. Alexandra McKillop and licensed acupuncturist Monique Wheeler. Before we turn it over to our speakers today, we just like to give a brief intro of Aligned Modern Health, just in case this is your first time joining a Digital Doc webinar. Aligned Modern Health is the Midwest's largest provider of alternative medicine. Alternative medicine simply means no drugs, no surgery. We really aim to get to the root cause of why our patients are feeling what they're feeling and not just focus on one siloed symptom or condition. We truly treat each patient as a unique individual with unique concerns and goals, and we really customize our treatment plans to tailor to those unique concerns and goals. We feature 18 clinic locations throughout the Chicagoland area, and we also feature some of our services via telemedicine in several US states. Our Chicagoland brick and mortar clinics are supported by a physical medicine practice, which includes access to chiropractic care, injury prevention and injury rehabilitation services, athletic performance support, and clinical massage therapy. Our clinics are also supported by acupuncture and some modalities under the traditional Chinese medicine umbrella. Acupuncture, really amazing to benefit physical pain symptoms, both acute and or chronic. Also some intangibles like stress, anxiety, depression, sleeplessness and insomnia, men's and women's health and hormone balancing. We have a nationally recognized fertility and pregnancy support program. We treat seasonal allergies, gastrointestinal issues, neurological disorders, and we also support these services with some other modalities under the traditional Chinese medicine umbrella, like customized herbal medicine, cupping, and moxibustion. We round out our services both in clinic and online via telemedicine in several US states, including Illinois and Colorado specifically, with our functional medicine and clinical nutrition practice. This practice aims to get to the root cause of why you're feeling what you're feeling by focusing on some internal diagnostics to better help us understand why we feel what we feel externally. We support a variety of gastrointestinal issues and autoimmune disorders, bloating, constipation, fatigue, migraines, hormone balancing, hormone replacement therapy, food sensitivity testing, sleeplessness. We also support this practice with nutritional counseling to help our patients navigate through any dietary journeys as part of their treatment plan. We are in network with most major insurance providers, and we are very happy to help you investigate your costs and coverage. And we also offer free 15-minute consultations for any of these practices in case you might have some questions that you'd like to speak directly to a provider about. Speaking of questions, we absolutely encourage your questions today here on the topic of PCOS. You are welcome to type your questions anytime into the Q&A feature of Zoom. That's the little icon on your Zoom bar with the two conversation bubbles labeled Q&A. You are welcome to type in your questions as you have them, and we will address questions at the end of the presentation. All of that said, it is now my pleasure to welcome Monique Wheeler to the conversation.
Thank you so much. My name is Monique Wheeler. I'm an acupuncturist and herbalist here with Aligned. I have been in practice since 2008. Currently, I am working in Evanston at our clinic, and I do see a lot of patients for physical pain, a variety of those presentations, as well as women's health disorders or conditions. And I do work on anxiety, depression, anything else that is getting in the way of you feeling 100%. I'm here with Dr. Alexandra McKillop, and I'll just let her introduce herself today.
Thanks, Monique. My name is Dr. Alexandra McKillop, and I am on the functional medicine team here with Aligned. I see patients virtually and also in person at our Killdeer office. I see patients with the full spectrum of health concerns, all ages and stages, but I particularly have a heart for women with hormonal concerns, menstrual problems, fertility issues. One of my favorite things is to help a couple conceive if that's a goal of theirs, and PCOS along those same lines makes up a big portion of my practice because it's such a hot topic and common concern among women. And that brings us actually to our topic today, which is PCOS. So PCOS stands for Polycystic Ovarian Syndrome, and it's one of the most common causes of infertility among women. And it's rising faster than ever. It's becoming increasingly common. The World Health Organization right now, I think the latest numbers estimate that up to 13% of reproductive age women are struggling with PCOS. So that means that if you don't have it yourself, you're pretty much guaranteed to know somebody who has it or have heard of it at the very least. And given this, you might be wondering a number of different things like, why is it so common? Where does it come from? What's to be done about it, right? All those things that we want to know when it comes to health. So PCOS, or Polycystic Ovarian Syndrome, is a hormonal disorder and a unique form of metabolic dysfunction as we understand it in medicine. And it's associated with problems like fertility, but also weight gain, metabolic syndrome, acne, changes in hair growth, and more. So it affects not only quality of life, but also some of the risk factors for chronic disease. It's really a lifestyle factor that we have to take into account when we're working up a patient. In the functional medicine realm, we ascribe to the Rotterdam criteria for making a diagnosis for PCOS, and that includes meeting 2 of 3 criteria. I'll share what those are. The first one is on blood work, we see signs of elevated androgens. Androgens is a term we use to refer to the hormones testosterone and DHEA. Oftentimes we think about those as male hormones. They're in all people. It's just we have different levels for optimal function for different categories of people, essentially. So high levels of either testosterone, DHEA, or both. The next criteria would be signs of ovulatory dysfunction, which means a person either does not ovulate or they ovulate at irregular intervals. Classically, in the menstrual cycle, there would be one ovulation one time, roughly every 30 days, give or take. But somebody who maybe goes 2 months, 3 months between cycles, that would be a sign of ovulatory dysfunction. Would also be ovulatory dysfunction if you have regular periods, but you're not actually ovulating in that cycle. And then the third criteria would be where polycystic ovarian syndrome gets its name, which is the polycystic appearance of ovaries on ultrasound. So if a person were to have a pelvic ultrasound looking at the ovaries, you can count the number of developing eggs or follicles. That would be called antral follicle count, if you've seen that terminology on your own ultrasound report. And if there are too many, that would classify you as having polycystic ovaries. And one of the things that I do want to differentiate here is this is not the same as a classic functional ovarian cyst. That's the type that you might associate with severe pain, irregular bleeding, sometimes the need for surgery. Polycystic ovaries are different. They're actually not true cysts. It's just that polycystic appearance. So in order to be diagnosed with PCOS, according to this Rotterdam criteria, someone will need to meet 2 of those 3, which is elevated androgens, ovulatory dysfunction, and then polycystic appearance of ovaries on ultrasound. That is in the functional medicine paradigm, though. Traditional Chinese medicine looks at things differently and uses a different set of diagnostic factors. So Monique, why don't you explain a little bit about what that looks like in the realm of traditional Chinese medicine, how you work up a patient dealing with PCOS?
Oh, absolutely. Well, one of the first things that happens when I meet a woman who's having trouble ovulation is I go through a lot of questions, or as well as looking at their tongue, feeling their pulse. I'm trying to gather as much information as possible. Sometimes, like you said, they know because they've seen a functional medicine doctor, or they've seen their doctor, or maybe their mom had PCOS. So they suspect that it could be part of their issue, why they're not ovulating or they're not having their period very often. So what I start off with when someone does come in and say, I haven't had my period in 60, 90 days, and this has been going on for a couple of years, I go through this similar questions that I would ask any woman dealing with infertility, because I'm trying to figure out what your Chinese medicine pattern is, because every person is different. I'm sure you see this too with the variety of folks that you see with PCOS, but sometimes people with PCOS are overweight. Sometimes they're rather thin. It may not be the same exact presentation for everyone. And so that's going to determine how I treat you. I'm going to use points, Chinese herbs, and treatment styles that are going to be different based on what your pattern is. And sometimes we don't know initially it is PCOS if you haven't seen a functional medicine doctor or a medical doctor. But I regardless of what the reason is, I'm going to work on regulating your cycle. Then if we get more information that that's the cause, that's helpful. But even if you don't know that to start, I'm going to be treating you for what I see happening. And with women with PCOS, it's usually a presentation that there is some form of dampness. That's one of the terms that we use, which can be translated somewhat to inflammation. And then the kidneys, yang or yin, are usually involved as well. Did you want to talk about the types that you guys see?
Yeah. So I love how you were talking about different patterns. And that's one of the things that makes addressing, diagnosing, and treating a patient with PCOS challenging and very unique, because not everybody with PCOS, like you mentioned, has the same presentation. So there are different symptoms that some people might deal with. And also, as we understand in functional medicine, different underlying root causes. We actually categorize PCOS patients according to those 4 underlying root causes. And so I wanted to talk about a couple of those, starting with what we call post-pill PCOS. Post-pill PCOS is pretty much what it sounds like. It's a type of PCOS that develops after a person comes off of the birth control pill or other forms of hormonal contraception. So it's not just exclusive to the pill packs. Hormonal IUDs or patches, injections can also produce this PCOS syndrome. And the reason that happens is because when a person is using a hormonal contraceptive, the whole purpose is to shut down ovulation. Ovulation is releasing an egg, no pregnancy, ergo hormonal contraception. And the way that that's accomplished is because these hormones that you're using through that hormonal contraceptive device trick your brain into thinking that you've already ovulated, and so no subsequent egg is released. Well, when you remove those hormones and you take away that contraceptive device, your brain has to remember what it means to talk to your ovaries. And sometimes it doesn't do that very well, or the ovaries become a little too excited. The brain says, hey, let's do this. And the ovaries jump for joy when maybe they should, a simple okay would have been just fine. And in that excited response, sometimes we see overproduction of some of those ovarian hormones, namely testosterone and DHEA, which ordinarily we would want to see at relatively low levels. Post-pill, sometimes they jump up really high. And that high androgen level, that high testosterone or DHEA, meets one of those first criteria for the diagnosis, but then also produces some of the other diagnostic criteria, meaning sometimes producing dysfunctional ovulation, and also some of the symptoms that we see with PCOS. Monique, when you're working with a patient that comes off of the birth control pill or other forms of hormonal contraceptives, what does that look like from a Chinese medicine perspective, and what challenges do you encounter?
It is similar to what you're talking about. In Chinese medicine, we have a diagnosis that connects the heart and the kidneys. That might not mean anything to folks. It doesn't mean you're having a heart condition or a kidney physical condition. But like you're describing, what I'm trying to do is get your body, your endocrine system, to work throughout the body, to be connected. And that is something that when you're on the pill, your body isn't having to do that work, right? You're not ovulating every month, or when you're using hormonal contraception. Whatever it is, that activity is no longer occurring, that monthly ovulation. And so, like you, I'm trying to jumpstart the body. I'm trying to connect different parts of the body so that communication can happen and your endocrine system can get back into balance. Because ultimately in Chinese medicine, I'm looking to balance whatever is going on in your system. And it can look different for different people. But this post-pill or post-contraception presentation usually means we have to get the HPA axis actually going again, but we use different terms.
Yeah. And when we're talking about that communication, I love how you're talking about some of the yin and yang organs and some of the different language that you use in traditional Chinese medicine. The different hormonal systems of the body, as we see it in functional medicine, there's intercommunication. So one system affects another, and reciprocally, it's a vice versa as well. And when we're looking at PCOS, we see that there are many problems that develop. It's not just okay, you came off the pill and now you have PCOS. Okay, you came off the pill, you have PCOS, and now we're seeing inflammation and we're seeing potentially some other physiologic issues. So one of the things that's common among all cases of PCOS is inflammation. And there actually is an entire category of PCOS that we categorize as inflammatory PCOS. We make that determination by a series of exclusions, right? So if a person doesn't have post-pill PCOS if they've never used a contraception, right? That rules out that form. One of the other forms that we have is inflammation. And while all persons who have PCOS do have some degree of inflammation, there is a subset of inflammatory PCOS where those inflammatory markers are really, really high. And a person might be dealing with some inflammatory type symptoms at a higher rate than perhaps people who fall into some of the other patterns. And those might include things like pain, muscle pain, aching, sometimes a predisposition to have redness of the skin. Acne tends to be a very inflammatory driven condition. Sometimes weight gain is a part of that. And in order to address somebody who has inflammatory PCOS versus someone who's post-pill, to make that differentiation, the big thing post-pill is to help rebuild that communication. Like you mentioned, Monique, we're doing that the same way in functional medicine, just potentially with some adjunctive therapies and of course co-managing inflammatory PCOS. Our main focus has to be getting down that inflammation, because what we see there is that it's driving those other symptoms and syndromes that go along with PCOS. So we look at things like inflammatory cytokines. On blood work, we'll measure things like C-reactive protein, sedimentation rate, and also looking for signs of inflammation in other systems of the body, like the gut or the nervous system and things like that. How do you handle inflammation in the traditional Chinese medicine paradigm?
Yeah, it's very similar. And one thing I do love about functional medicine is that you're looking at more than one system. It's not like when you go to your traditional gynecologist and they're looking only at your lower abdomen, right? Like you're talking about, when someone comes in, I'm going to ask them a lot of questions about what's going on for them, and I'm going to observe them. Sometimes it's true, they're going to have redness in the skin, they may have acne. A lot of times people are suffering from migraines or headaches, or they do have chronic gut issues or joint pain. So I'm going to take all of that into account when I'm coming up with the diagnosis, the Chinese medicine diagnosis, because it's complicated. It's not just a one and done kind of thing. And what I'm going to do is tailor your treatment based on what I see. Now, some people who are inflamed are actually more on the cold spectrum. So you may not have quite as many symptoms of redness, but you might also have a lot of inflammation. And I would notice that maybe on your tongue with a thicker coating. So it's really dependent on how the person presents when they come in. I do acupuncture on everyone, of course. And then sometimes when I'm trying to assess how inflamed a woman is, I'll do some cupping on them at the end on the back. And the color that comes out with cupping a lot of times helps me understand the severity or how deep and what type of inflammation I'm really dealing with. And then over time, those colors change. That's the way we see things also progressing, as well as, of course, women getting their cycle and having other symptoms or signs that come up. But I do see, and people progressing with like their pain is better, as well as their hormones are more in balance.
That's one of the things that I love about learning about Chinese medicine is how you incorporate some of these other constitutional factors, things like coloration and potentially inside of the mouth and what that would look like versus just the empirical data like on lab results. Also environmental factors, right? You mentioned stress as part of that, or different patterns that you might see. When we think about working up a patient with PCOS, we always have to look at lifestyle as well. Sometimes our lifestyle habits do drive some of the underlying root causes of an issue like PCOS or really anything else. And one of the things that I want to clarify as I say that is it's not that your lifestyle causes PCOS. There's generally a genetic predisposition, but there are certain environmental factors that can potentially trigger that or perpetuate the problem. And stress being a big one of those that probably is a problem for everybody. In fact, I don't know that I've ever met somebody in my life, clinical or otherwise, who has not dealt with stress in some capacity. But people who have particular challenges with stress, meaning that they don't have good strategies for managing it, or they're going through particularly stressful times, or just the nature of their lifestyle or other health conditions creates a major stress on them. Those are things that we understand to be major drivers of another subset of PCOS that we call adrenal PCOS. That term adrenal is referring to glands that are inside the abdomen called the adrenal glands, and they are responsible for helping the body regulate the stress response and tolerance to stressful events, environmental, major events, or chronic stress. And in certain individuals, sometimes there's a breakdown in that system and the body loses its ability to regulate. And we see this overdrive pattern, particularly in the case of adrenal PCOS. We see the androgen DHEA spike up. DHEA is a little bit unique when we're talking about hormones because both the adrenal glands and the ovaries produce DHEA. So it can come from two places. So a person with adrenal PCOS, their ovaries ordinarily might be producing perfectly fine levels of androgens. It's just the adrenal glands are getting a little bit too excited because of a breakdown in the stress response, because of chronic stress in a person's lifestyle, sometimes even genetic factors. Oversized adrenal glands or overfunctioning adrenal glands, such as a condition called congenital adrenal hyperplasia, can contribute. So it's nuanced, of course, but we do need to always look at environment, lifestyle, and the demands on a person physically and culturally in order to understand a little bit more. With adrenal PCOS, one of the things that I really tend to find being problematic is sleep disruption, because your sleep-wake cycle relates very closely to your stress response and stress management. I've had patients who are shift workers where they're living separately from, the sunrise and sunset, and that creates problems with the adrenal response. So treating adrenal PCOS, like the other categories of PCOS, really does necessitate that we look at not just lab work, but what are you doing sun up to sundown, when you wake up in the morning and go to bed, and how is that impacting you on a hormonal level? What do you see with environmental factors in your practice, Monique?
Oh, absolutely. You were talking about shift workers, and I was just remembering I've treated specifically nurses who work, their regular shift overnight and losing their cycle, right? It might not be a PCOS presentation, but they fall then into amenorrhea. And so our bodies are very sensitive to different types of stressors like you're talking about. We have way more chemicals, I feel like, in the world these days. Some people are better at detoxing those than others. That produces stress. And one of the things that I like to do with women who are working on fertility or just their female, like any health issue that they're dealing with, is to ask them to do basal body temping. Sometimes that causes a lot of stress in itself. So we kind of have to figure out if that's something a woman can tolerate, but it is a really great way for me to get a picture of what's going on with your endocrine system day by day. Usually someone who is in the kind of like adrenal fatigue presentation, those are wired and tired folks. That's what I see often. And I'm going to have to deal with stress, or I am going to have stress as a part of your treatment plan, regardless of what your maybe primary diagnosis is. But for some folks, it's going to be the biggest chunk, right? We're going to really, really work on stress with the acupuncture points, with the herbs, as well as with asking you to do different things in your lifestyle. So, I feel like I say the same thing again, but with me, it's very much figuring out what your pattern is and tailoring treatment to that. And then it takes time to move the needle, right? I was thinking about this as like steering a really large boat. And so usually women who are coming in for treatment for whatever cycle regulation issue, including PCOS, is I'm going to need to see you weekly for probably about 3 months. That's where you're going to get the best results from this treatment. And of course, herbs are going to help too, and other changes that they can make, especially working with functional medicine as well. I see women get results quicker when they're willing to do more than one modality, for sure.
Definitely. And I really appreciate how you pointed out the time piece. I think, especially on a fertility timeline, it's like, I wanted to be pregnant yesterday. How long am I going to have to wait? Right. And the time piece, unfortunately, and fortunately, depending on how you look at it, is both an ally and something that you kind of have to wrap your mind around. But healing takes time. And when it comes to ovulation, when it comes to hormone production, any given egg that's released in a certain cycle really is not just, here's my egg for this month. It's like 3 months in the making. And so a minimum of 3 months to change the egg And then from there, then we start to see changes in hormone production. Then we start to see changes in the downstream effects of those aberrant hormone levels. One example that comes to mind is in the case of my fourth category that I have, which is insulin-resistant PCOS. A lot of times people with insulin resistance are dealing with metabolic issues, sometimes weight challenges that go hand in hand with that. And the question comes up of how long is it going to take to be able to lose weight or to be able to see some of these other metabolic changes I'm antsy to start seeing. And while it does take some time, but as the healing progresses, you get there. Insulin-resistant PCOS actually makes up the largest proportion of PCOS patients that I see. An estimated 50 to 70%, I think, are the current numbers for what proportion of PCOS patients as a whole are dealing with. And in this category, people have difficulty with regulating blood sugar. That leads to insulin spikes. And then that insulin does a lot of stuff that we would prefer it not to at certain times in our bodies. There's actually a theory or an understanding in medicine right now that PCOS really functions as insulin resistance of the ovary itself. So when we're looking at the impacts of blood sugar and we're looking at the impacts of other hormones like insulin, it really matters for your ovary on its own and then the subsequent hormones that it produces. One of the paradoxical things that I see about the relationship between testosterone and insulin and female reproductive health is in women, high testosterone creates insulin resistance, and in men, it has the opposite effect. It improves blood sugar. So it's a little bit of an interesting dichotomy there when we're really focusing on individual specific hormone levels and being able to address, okay, hormones like insulin drive testosterone, and hormones like testosterone are driving your insulin. So where do we interrupt that cycle as it's like this boulder rolling downhill, picking up speed? But once we figure that out, and once we're able to really bring about one parameter of change, particularly with the blood sugar and the metabolism, that's when things start getting back into place. We can get that egg developing, and then we can start to see those other hormones falling back into place. Monique, when you're working on a patient who's dealing with other parallel problems in their health, what are some of the challenges that you see? What are some of the successes that you see?
Great question. I think one of the things that really helps with the way that acupuncture works is that I see patients pretty often. So I'm getting to hear about how each week is going, what is happening in their body, and we can change course really quickly. We can add something, we can change something. And I get to really know my patients pretty intimately when I'm seeing them this frequently, which is pretty much everyone, but especially if we're together for 12 weeks. And no one is going to lead a perfect life. We have a lot of stress in the world. We're all just going to do the best we can. And over time, changes kind of add up, like you're talking about. And after a month, like I might see a woman who hasn't ovulated in a couple of months, and then the first 6 weeks of treatment, like they ovulate in 6 weeks, and then the next month it's more like 5 weeks. And that's sort of how the changes look to me often. And what I say to women too, who are very, there's a lot of pressure about getting pregnant. That can be a stressful experience in itself, but you want to be the healthiest mom, right? You want the healthiest baby that you can have. And that takes time so that we can kind of get you ready. And let's get you into pregnancy feeling great, right? Because if you have PCOS and you have shoulder pain or back pain, pregnancy is fabulous for many women, but it's also another challenge on the body, right? And then you have a little baby and you're carrying that baby around. So I'm really trying to help my patients in that moment, but also for the future, right? Like, how are we going to set this up for success? And I would also like to say, and I'm sure you do this as well, but sometimes I need to see both partners, right? So a woman might have PCOS and her husband may have some issues too, but she's the one that gets kind of the diagnosis first. So oftentimes both partners having treatment can lead to success even quicker as well.
Oh, for sure. I love how you were bringing up the different environmental factors for treatment too, right? What does it look like to be a patient of traditional Chinese medicine? What does it look like to be undergoing treatment of acupuncture? It means regular meetings. It means looking at your whole lifestyle. It means looking at your partner and some of those different things. And functional medicine, of course, is the same. We're looking at nutrition. We're looking at exercise, sleep, stress management, detoxification. Those are like the load-bearing walls of your house that you need to hold up your roof. And if any one of them is crumbling down, well, the whole roof goes with it, right? And that's one of the things that I really love about co-managing with you, Monique, when I have the privilege of doing that, or any of the other acupuncturists on our team, is we are always using different language, right? You speak in the language of, meridians and your heart chi and your spleen chi and phlegm, and we're using the language of inflammatory markers and testosterone, but we're addressing the whole person together. I'm addressing the whole person as I see them, and you're addressing the whole person as you see them. And then together as a team, we're working together and co-managing that case and that family, if they have a fertility goal, but also just as an individual. You want to be the healthiest mom you can be, or the healthiest person for yourself, right? And that's a privilege to be part of that team and to be playing a small role in a person's lifestyle. And I think that just makes an excellent transition to know, what are your individual values? All you who are listening here, what questions do you have? What are the things that you're looking to get from integrative medicine? Let's open up the floor to some questions.
Thank you so much, Dr. McKillop. Thank you, Monique. Yes, we will absolutely open the floor to questions. We do have a few great questions already shared, and please go ahead and continue to type your questions into the Q&A feature on Zoom. If you do have a very specific or personalized question, we may recommend a free 15-minute consultation so you can meet one-on-one with a provider, where they can learn a little bit more about you and your history so that they can best answer your question. If you would like that free 15-minute consultation, you can give us a call at 773-692-6700, or you can request that online at alignedmodernhealth.com. Diving into some of the questions that we have so far. Dr. McKillop, at the very beginning of the conversation, you talked about potentially having a period, but not ovulating. Is there some way that folks can tell that that's happening, or is there certain testing that needs to be done? How would somebody know that they're not ovulating if they do have a period?
Yeah, that's a great question, and one that many women actually are dealing with. So one thing that I want to bring up here is that a period doesn't mean that you had ovulation. So it is possible to bleed without that. That's the whole concept behind like the birth control pill. You have a period, but it's anovulatory. So there are a couple of ways that you can go about figuring that out. One is you could get a blood test to look for progesterone, because you can only make your own progesterone if you ovulate. And the other is by using some polymorphic data. So things like tracking basal body temperature, or BBT. Monique touched on this earlier, where a person would take their temperature every morning. One of the things that's really amazing about the human body is we're always in flux. And so pre-ovulation to post-ovulation, a person's metabolism increases post-ovulation, and you actually can measure that with a change in your body temperature. 98.6 is not true of everybody, and it's not true at all points in the cycle. There are also some other less specific markers, like changes in resting heart rate or changes in cervical fluid. There are some urinary test strips that are available over the counter that can give some clues about ovulation as well.
Amazing. Thank you so much. We got this question a few times, so I want to address it for sure. And I think it's a great one. Somebody that has been diagnosed with PCOS, will they technically have that their entire life? Or is there a time where this can be quote unquote cured or healed, where they are no longer PCOS positive, so to speak?
I'm happy to jump in on that one, unless you have anything, Monique. So PCOS is a syndrome, which means that it's classified according to symptoms. So those symptoms very much can go into remission, and you would not be presenting at that time as someone who's dealing with PCOS. And that's something that we see commonly in functional medicine and in acupuncture. A patient gets their symptoms under control by addressing the underlying root causes. A person might have a genetic predisposition to developing that syndrome. And it might be something that they keep under control with lifelong management strategies, but it's not necessarily like, I have an autoimmune disease, therefore I've always got this autoimmune disease.
That was exactly what I was going to say, that there's a lot of management, and also women's bodies change after they have children sometimes. And so it really is, it's on a case-by-case basis. But I also like to say that we all have the job of taking care of our bodies for the rest of our lives. So just because things start to clear up or get better, it's almost like you can go to the gym once and you're going to feel better or get some exercise benefits, but you're not going to get in shape, right, from one gym visit. So it's like, you know, taking care of your body in terms of holistic health is kind of a lifelong process, but it doesn't have to look as intense as it does when we're initially starting to work with you.
Thank you so much. A couple of questions based on different kinds of symptoms from PCOS. Monique, I'd love to start with you on this one because I know acupuncture and Chinese medicine often works with the skin and dermatological conditions. And then Dr. McKillop, if you can also chime in thereafter. Question about acne and PCOS. Somebody concerned that if they come off of the medication they're on, that's kind of taking care of things or keeping things in check right now. They're worried they may have a severe breakout, but are potentially interested in doing something a little bit more holistic or alternative than staying at the medication they're on. Can you speak to that a little bit as regards to acne and other skin conditions that might be hormonal or PCOS related?
Oh, absolutely. And I would say that in my experience, women on spironolactone or other drugs to kind of help with hormonal acne, when they get off of those medications, we can do treatment that focuses on that. That's definitely going to be a part of it. We can also use Chinese herbs. It's not as quick per se as something like that medication. So it does take time and there's definitely changes, but I do see women have improvement with hormonal acne through treatment and not having to take the spironolactone or other medications.
I agree with that, and I see a similar pattern as well, Monique. When someone is using spironolactone, so spironolactone is a drug that blocks androgens or blocks production of testosterone and DHEA, which is why it could potentially improve that symptom of PCOS. So we would do something similar in functional medicine. You come off spironolactone, and that gives us the room and the space that we need to identify where is your high androgen level coming from, and then how can we address that at the root cause. So definitely we can bring down symptoms like that. It just takes a little bit of time to figure out, okay, where is the issue really coming from and how do we address it there?
Thank you. That was a great segue into a little bit of a vocabulary question because you just mentioned a few of the words again, Dr. McKillop. We have a question here. If you can tell us the difference or maybe a brief definition of testosterone, androgens, and DHEA.
Yeah, that's one that gets confusing really quickly. So I empathize with that. The way I'd like to present this is androgens is the umbrella term, and testosterone and DHEA both fall underneath that. So kind of like dogs is the umbrella term, but you can have a Rottweiler and a Border Collie. They're both dogs, but they look a little different. Same thing with the androgens that we have there. Androgens connects them all, and then there's individual types of hormones in between there.
Thank you for that clarification. I know that's really helpful when we kind of know the meanings of words or we know what they're referencing, but it's always helpful to know exactly what we're talking about. We have a couple of questions here that focus on exercise and working out and weight loss. Do you have any thoughts on different types of workouts when somebody does suffer from PCOS or has in the past, if they have trouble losing weight while exercising? Are there any thoughts there? Or is that something more custom to each individual person that would be best answered on a free consult?
You want to take that one, Monique?
Sure. Yeah, absolutely. It can be very difficult for folks to lose weight when they have hormonal imbalances. So sometimes I do think high intensity workouts can be helpful, but I also really think it's going to be tailored to the individual. And I'm going to support you with Chinese herbs and treatment in that process. I am sure that is what Dr. McKillop would also do with functional medicine. And I do see that recommendation is made, and I do think it's a good one, but it can be tough, even with doing that treatment without, other assistance, herbs, supplements, acupuncture treatment.
Yeah, definitely. I would say, and as I often do say to some of my patients, the best type of exercise for you is the kind that you love doing, because you don't want to have a health practice that feels like a slog, right? So
Yep.
generally speaking, it's better to do something that you love, because that adds value to your life in multiple avenues. At the same time, we do look at things holistically, on an individual case by case basis. Somebody who's got a lot of inflammation and they feel worse after exercising in a certain way, well, it's usually a sign that your body needs a little bit more rest or maybe some other support. So it does vary patient to patient and person to person.
Thank you. I love the idea of the best exercise is the one that you love, or perhaps the one that you do, because we know, movement is medicine, right? But we also know that exercise is a stressor on the body in a lot of ways, even when it's good for us or we enjoy it or there are benefits. And so I think it's really important that when dealing with something like PCOS or infertility or other hormonal imbalances, we don't want to add additional stress, right? We're already likely dealing with stress, and we want to make sure that we're doing good things for our body and not getting into the I should do this or I should do this, but I hate doing this and that kind of thing. So I really appreciate both of your perspectives. We do have time just for one or two more questions here. Um, let's see. We talked a little bit about IUDs and kind of like the post pill PCOS or the post hormonal contraceptive PCOS. If somebody is currently on an IUD and they plan to take it out at some point to try and get pregnant, is there a constant worry, or is it really unique to each individual about how they may react to removing the IUD?
One thing that I want to clarify just at the onset here is there are two different types of IUDs. There are hormonal and non-hormonal. The non-hormonal IUD is called Paragard, or also known as the copper IUD. That one does not have hormonal implications, but it can cause some other challenges for people. Hormonal IUDs fall into three other types: Kyla, or excuse me, Kylena, Skyla, and Mirena, that have different levels of hormone, which are going to have different systemic effects, all of them being designed at doing two things. One is helping to reduce the frequency of ovulation. Two is thinning the uterine lining. If a person who has an IUD is experiencing anovulation, meaning they're not ovulating, that does create additional challenges when you're looking at a fertility timeline, because we can potentially run into that post-pill PCOS or other types of fertility challenges of getting the body back to what it's supposed to be doing. Women who do ovulate when they have the IUD, a hormonal IUD, that would look a little bit different. So it really is person by person, depending on the IUD that you have, depending on what your goals are, and depending on how your body's responding to it.
Thank you so much. We have time for just one more question, but we do have many other questions that are great that we did not have a chance to answer live. Please know that we see your questions. We'd be happy to speak with you in a free consultation, or you can certainly email the email address that you received when you registered, if you do still want to connect live with a provider. But the last question we're going to take here actually ties right into that. It's a totally valid, fair question, because a lot of this can seem very overwhelming. The question we have is, how do you know where to start? Should I start with functional medicine? Should I start with acupuncture? Is it common to do both together? And I'll take a little bit of that in myself if I can. I would absolutely recommend scheduling a free 15-minute consultation with a functional medicine provider and with an acupuncturist. You are welcome to do one of each. A lot of times, the kinds of questions you ask and the kinds of questions that we ask of you in those free consults will help you better understand how each practice works, what to expect, and kind of how the practice may benefit you. And yes, it is incredibly common to do both. We are an integrative health practice, and that means our expert providers work together on a very regular basis to maximize the outcomes of our patients' treatment plans. So while acupuncture and Chinese medicine and herbal medicine may be very effective on its own, functional medicine may be very effective on its own, it really does allow us to maximize patient outcomes when we are working together, because we are looking at you as a unique individual from multiple perspectives, and we're treating holistically and integratively together. But yes, sometimes it is very hard to know where to start. It is overwhelming to be in a position like this and then to want to help yourself, and we understand that. So that is one main reason we offer the free 15-minute consults. It's dedicated one-on-one time directly with a provider to get your questions answered, to learn all the things that make you feel comfortable to find the right path for you. I want to thank you, Monique and Dr. McKillop, for joining us. I want to thank everybody that is still live on the call. And I also want to thank everybody that is watching the recording. We appreciate your time and we appreciate your questions. That does bring us to time for today. But again, if we have questions left unanswered, please do not hesitate to reach out. We are absolutely here for you and happy to help. Thank you so much. We hope you have a great day. Cheers.